we're gonna continue our discussion here on skin cancer. So risk factors of skin cancer. I'm gonna stop talking in this accent. But risk factors of skin cancer are excessive exposure to UV rays, UV lights. Stay the hell out of the tanning bed. Really, it's not worth it. I know the bronze is beautiful, but you're beautiful just the way you are. That's it. You don't need to increase your risk of skin cancer and try to get a little darker color to your skin there. Another risk factor of skin cancer is medicines that inhibit melanin production. So as we learned, melanin does hover around the keratinocytes, the DNA or the nucleus of keratinocytes to protect the DNA. So if you have the medicines that inhibit or block the melanin production, you're I can't say that, but you are. But another risk factor of skin cancer is light skin color. Obviously, there's less melanin produced with lighter folk because more melanin produced, there's darker, causes darker skin. Less melanin produced, obviously lighter skin. We all have the same melanocytes, amount of melanocytes, but what differs is the amount of melanin produced. So lighter skin, you're more susceptible to skin cancer. Smoking is another risk factor. Smoking is it's bad news. Don't do it. Cigarettes they cause no good. They're no good. Only harm, no good. So they are a risk factor, obviously, of skin cancer as well. Diminished immunity. Our immune system's always trying to keep us well and keep us healthy. If there's diminished immunity, does increase the risk of skin cancer. Also, the location of the home can be a risk factor. If you're closer to the equator, this is kind of common sense. You're getting more sun, more exposure to UV rays. That's a risk of skin cancer. People who work outside, truck drivers, you got the trucker's tan hanging out the window, sun always going in the face. But that's no joke. I mean, you increase your exposure to UV rays, you're increasing your risk of skin cancer. You really are. Now, not all truck drivers get skin cancer, but definitely increase the risk, put it that way. Another risk factor of skin cancer is genetics. Genetics are a major factor of a lot of things that happen in our life and a lot of results, but just because you're genetically maybe more susceptible, it doesn't mean you're guaranteed going to get skin cancer. You definitely do need to be more cautious, more prudent, and wear that sunblock more often, perhaps. And we should all be wearing sunblock. But if your genetics make you more susceptible to skin cancer, definitely needs to be top of mind every time you step outside. Also, a risk factor of skin cancer is personal history of skin cancer or sunburn. So if you've had a lot of sunburn in the past or a risk of skin cancer, if you've had skin cancer or many sunburns in the past or sunburn in the past, that does definitely increase your risk of skin cancer today and in the future. So just be aware, be cognizant. If you have greater than 40 moles, that's also a sign, a risk factor of skin cancer. So risk factor doesn't mean you're guaranteed to have skin cancer, but it is kind of a red flag, a caution, like, hey, beware type of thing. Beware, there's a dog in the yard, so don't go in. So just honestly be cautious if any of these risk factors do hit home to you, if you will. Another risk factor of skin cancer, last but certainly not least, is age. So the older you are, obviously the more UV rays you're going to have had exposed to in your life, which increases your risk of skin cancer. So there's quite a few risks. Doesn't mean you're guaranteed to have skin cancer if you fall under one of these categories, but it's definitely something to pay attention to there.